you look all across the country, it's lower income communities, predominantly minority, where we're still seeing an increase in the numbers. We looked at that in New York City. We did a very extensive research project, and it is true. You can look at where the cases are coming, look at the testing data by geographic area, by zip code, and find out where the cases are coming from. We asked Northwell Health, which is the largest health system in the state, to do an extensive test for us. We're in the midst of that test, but we have back about 8,000 tests, which is a very large sample. And the data is very powerful and informs what we're doing going forward. The test was done in New York City because that's where we have the highest predominance of cases. But in lower-income communities, communities of color, we partnered with the faith-based community, with churches, to conduct tests. We found about 27% of the individuals testing positive. 27%, that's compared to the New York City general population of about 19%, okay? The Bronx had the highest percentage, 34%, again compared to a citywide average of 19%. Then Brooklyn, then Manhattan, then Queens. Staten Island was right at the New York City overall number. And we're going to develop targeted strategies to these highly impacted communities. What we're seeing in New York City is going to be true across the state. Northwell Health is going to double the number of churches that they're working in, 44 total churches. We're going to partner with Somos Community Care, and I want to thank them very much for stepping up. They're going to open 28 additional testing sites in these zip codes that fit this profile. We're going to focus on public housing. We understand the challenge, and ready responders are going to increase the testing in 40 public housing developments in New York City. So this is going to be a very extensive effort between Northwell and Somos. You'll have 72 faith-based sites. You'll then have ready responders in public housing. And we want to now take the next step, which is outreach programs, getting the PPE into the community, getting the hand sanitizer into the community, explaining social distancing and why that's so important, and explain how this virus spreads. It's a public health education effort. Capital District will reopen today. We're working with religious institutions. Right now, they can have up to 10 people with strict social distancing guidelines at religious gatherings. We've asked them to consider drive-in and parking lot services for religious ceremonies, but we're going to be working with our Interfaith Advisory Council.